Let's turn to what is happening with the virus, Alex. New daily hospitalizations in Florida now reaching 435 versus 409 a day ago. Texas is also seeing an increase in new cases. Dr. Ogechika Alozie joining us now, Texas Medical Association COVID-19 Task Force. Thank you very much indeed for your time, Dr. Alozie. We've seen cases picking up. We're now seeing hospitalizations picking up. Is it inevitable that we are going to see mortality picking up?
First of all, thank you both for having me. And I think you jumped right to the point, which is cases, hospitalizations, unfortunately deaths. One of the things that people sort of forget to remember is that if we remove the Northeast from the data that we see right now, we're already seeing an uptick in those deaths. Hopefully, we know how to treat COVID-19 much better today than we did in March and April. People are younger. Potentially that may change the trend, but it's kind of an inevitability.
So can you help us understand and paint the picture of us of what's actually happening in Texas? What's it kind of like on the ground? Because I'm wondering why in some ways were we surprised that cases will lead to deaths? We saw what happened in New York. Why wasn't inventory built, et cetera? Can you give me some insight into that?
Yeah, definitely. And I think it's a great question. I think one of the things that happened is that we as a country, especially in the South and the Southeast, developed fatigue. And so people decided that since it didn't affect them, this was a Northeast problem. This was a New York, New Jersey issue. And as we started to open, we started to build up those reservoirs of infection, city by city, county by county. And we're really reaping some of that movement that we sowed earlier. And so it's unfortunate what we're seeing. We're at a point now where, as you understand, in Houston and Dallas, some of the medical centers are really concerned, not just about beds, but about staffing. Right? You can only task the human body, whether it's on the physician, the nursing, the tech side, so much until people actually have their own sort of burnout. And so we're really worried about what's going on. And we are asking people as much as possible, right? Those 3 W's have to be looked at. It's wear your mask, wash your hands, watch your physical distance. And I really add a 4th W, which is watch your symptoms. If you're sick, try to isolate or get to a hospital to get the best care possible.
How has the demographic changed? There's this argument that kind of circulates around in the financial markets that younger people are now getting it. They are less likely to need hospitalization, and if they do need hospitalization, they're less likely to die. And as a result of which, this is becoming a manageable process. Is that a fair reflection of what you're seeing there? Certainly the stats would speak against it, but nevertheless, I still hear that argument.
I will say this, if we look at the people that are getting infected, they do seem to skew younger. However, those people don't necessarily live alone. They have parents that they live with, they have grandparents that they live with. And so when we're looking at deaths, the deaths are still in the 60 to 80 predominantly, but unfortunately, you're still hearing those cases of younger people passing away, with or without comorbidities. I think it's a selfish narrative for people just to say, well, because young people are getting it, we don't have to worry anymore. We're hopeful that the therapeutics we have today, whether it's remdesivir, dexamethasone, some of the ICU processes that we're hoping can prolong lives, right? Not putting everybody on a ventilator immediately can change that mortality. But here's what I tell people. If you only have 10 beds and 20 people need it, you're still going to have an increase in mortality. If you double the number of people coming into the hospital, even if you cut the fatality rate in half, you're still where you started from. And that's really concerning.
Okay, that's an excellent point. Guy brings this point up a lot when we talk about the virus, in that if you're outdoors, the feeling is that wear a mask outdoors, you'll be okay. The problem that Texas is now experiencing is that it's hot, so you're actually indoors. And I wonder if this is now a template for how the East has to think about the virus when it gets cold and we can't be outside.
Yeah, again, great point. I think that the conversation around whether heat affects it, we've seen that doesn't seem to be the case. It's burning throughout the South. I actually like the analogy of this is not a wave or a surge. This is a campfire that we never put out properly, and the embers have blown into the forest, and now it's burning out of control. Whether it's outside or inside, I think those 3+1 W's are really critical critically important. But people have to really start to understand what are their risks. And that's one of the things that the Texas Medical Association has done deliberately by creating our sort of risk profile, giving people a gauge of what's a higher risk than the other so they can take that personal, social, and family responsibility that they need to be safe.
What do you think about sending kids back to school?
So I laugh not because it's funny. I mean, these are really serious issues. I have a 14-year-old and a 10-year-old that are desperate themselves to go back to school. And I think if we look at the largest data set we have, it was the data set that the CDC talks about from China. The rates seem to be really low, 0.6 needing critical care, less than 5% in terms of transmission. And I understand that as an epidemiologist as well. But I think it's also important that when we talk about these numbers, we talk about them in abstract. When it's your family, do you want to put 20 million people on top of that 0.6%? Really quickly, that becomes a number that's not tenable. It becomes a number that we can't talk about. And I'm not saying that people shouldn't go back to school. I really do believe that going back to school is going to be a crucial part of our journey to getting our economy back, because people worry about the economy. But we have to go back to school safely. There have to be safeguards, whether it's staggered classes, certain pods, whether it's spacing the classes out. To throw all these kids back into school and just roll the dice, I don't think that's an acceptable answer. And I think we really need to have a serious conversation about that.